Yeah, our own interest is adoptive T-cell therapy. So, the EBV cytotoxic lymphocyte is one approach. But, we do a lot of nowadays, a lot of chimeric antigen T-cell therapy, or we refer to CAR-T. And it's been FDA approved for certain indications, and we use it in our center pretty often. Now, the CAR-T is very effective. The problem with it is associated toxicity. So we do see cytokine release syndromes. We do see neurotoxicity, which we refer to by ICANS. So as a neurotoxicity associated with the effector cells. And we have protocols done at national level where the consensus how we treat those complications. We found in our own experience that Anakinra, which is an IL-1 blocker, to be very effective in a patient with neurotoxicity. There has been a preclinical model to suggest efficacy when you block IL-1. IL-1 as a cytokines was known to be increased in patients with neurotoxicity. So logically, the blocking that, it could lead to efficacy. There is national studies to use it as a preventative for neurotoxicity, to give Anakinra as a prevention. Nothing approved yet. We use it as a additional therapy to the standard approach, which is usually is a steroids. So for our own experience, we reported early on, and we have more patients now for future to report. But we report our prior experience where we have 9 patients who has a grade 3 or more neurotoxicity and received Anakinra as additional therapy. And those patient populations, we noted that the response was pretty quick. In those patients who response on average about 2 to 4 days from the initiation of Anakinra, the neurotoxicity was resolved compared to what we have historically from published studies from Zuma. The duration for neurotoxicity, it can last for 12 to 17 days once it is a grade 3 or more. So we report our experience being a signal that could be an effective additional therapy. And we haven't seen any, in those small samples, we haven't seen any signal to suggest increased risk of infections for those patients or any other complications. So from our own center, we adopted that approach where we consider to use Anakinra when patients developed severe neurotoxicity before waiting too long for this complication to continue.